We, in 2019, Tilganga received the certification of WHO Collaborating Center from the same Prime Minister who just left. And I'd like to let you know that that was an extremely proud moment for us. And our board in Tilganga, our executives, our staffs have, over the period of time, hours, days, months, and years, worked extremely relentlessly for a common goal, a vision, to provide comprehensive, inclusive, quality, and sustainable eye care with roots in the community. That was our common goal. And I take great pride in these people that I work with. I take pride in their skill, in their attitude, in their body language. It has been a wonderful many decades of working together with my colleague Rita and everybody else in Tilganga. I think it was, we started from scratch to this, what we are now. I also want to let the Honorable Minister, the Secretary of the Ministry of Health here to know that it's not very difficult to bring in hospital structures, infrastructures. But I think most difficult is the human resources. I always call the hardware is not very difficult, but it's the software which really gives you the impact, impetus, and the drive. So I think it's very important that the management of the software is extremely important. And in Nepal, we, along with many other stakeholders who have done tremendously fantastic work, have been able to, in the few decades, change the landscape of ophthalmology in a positive direction. One instance was Tilganga directly getting involved in reinventing small incision cataract surgery from the offices of Jerusalem to the communities, and we made it appropriately useful as a public health tool in the communities, and appropriating it to be integrated into the surgical delivery system, which helped to increase the cataract surgical coverage, cataract surgical rate, efficiency in many countries worldwide. And we also were one of the pioneers in this region to produce high quality, affordable intraocular lens, which was something that we could not think of having when we started with modern cataract surgery way back 3 decades ago. And to structure cataract surgically delivery system and refractive error delivery system, and subsequently develop subspecialty which was useful for the community. The other thing that we did very successfully was cost recovery. By instituting a pricing tier for the patients, we were successful in sustainability. And this model has worked very well, but it's important that we need to deliver good quality. Quality has to be sustainable, it has to be user-friendly, and there has to be commitment from the team and lots of good counseling. But cost recovery is extremely important in the next phase of our development in ophthalmology. And then we started scaling up our model beyond the boundaries to other countries, where we were received with affection and with lots of love because our model was effective, it was very steady, and it functioned very well in many other countries. So we are continuing to do that. Yeah. Thereby we started to contribute to both national and global health. We continue to come up with impactful innovations and training programs for surgical skills, refractive error, for many other processes. Now at this time, I like to mention TIO's, Tilganga Institute of Ophthalmology's, two formidable partners. The Himalayan Cataract Project, which now has become Cure Blindness, and the Fred Hollows Foundation. Two of our formidable partners. Interesting, we started about the same time, 3 decades ago. And very soon, in the next few days, the Himalayan Cataract Project is going to have its 30th anniversary. And Jeff, Katie, and we all will be celebrating it. Please come and join us. Tilganga's journey is more than a story of medical success. It is a narrative of hope, resilience, and profound impact to service of humanity. And before I conclude, I'd like to thank all the delegates here who have come from all over the world, and to IIPB for choosing Nepal as a venue. And just to let you know that if we have done the least, we have made Nepal self-reliant on intraocular lens and corneal tissues. Thank you very much.